All righty, and welcome. I am Professor Jennifer Harrison-Hauer, and this is your week 3. I'll just see Hannah and Shandani. What is going on with my Zoom? All right, you guys, let me see everyone's beautiful faces. Good evening. This is Professor Jennifer Harrison-Hauer, your week 3. I see Miss Hannah, Miss Shandani. Did I get your name right? She's like, it's don't even matter right now. It's Friday. Everybody show me your faces. Put your face on the screen. Put your face on the screen. All right. Let's go ahead and get started with congratulations on successfully completing your exam. I'm just checking my email from being in clinic today, and so I should have everything. There's a process. Let me just say that. It's not just little old me. There's things that have to go on behind the scene that I am not privy to or involved with. And we should have your exams posted no later than Wednesday, if not beforehand. There's analysis that goes on. I don't even look at your, so soon as I, as soon as they're posted, they'll be posted. Um, there was a question that someone, if you're wanting to, it says, I'll just read the email. It says, the student must attend the on-campus concept content reviews before we can meet with them for individual exam reviews. Faculty will conduct the content reviews. It will not be I. Um, the campus staff will then send the attendance. And when we meet for the individual exam reviews, we go over concepts only and not specific questions to maintain exam integrity. Oh, okay. So that's that. And then, so let me just get into our week and then we'll hold the questions to the end, please. I'll give you guys plenty of time. All right, sharing my screen. If someone can mute themselves, I hear static in the background. Please make sure you're on mute. I thought everybody, let me make sure I muted everyone. I thought I muted everyone. All right, so let's get into it. All right, so we're going to actually delve into the geriatrics and older adults, and then we'll finish up with pediatrics. So I'm going to start a little bit with chapter 7. So there are changes that occur, physiological changes that occur throughout our lifetime. So they want want you guys to specifically focus this week on your geriatric and your pediatric patients so that you can be aware of certain things as you're taking care of them in various settings. So for example, for your older adults, there will be changes in the amount of total body water and lean body mass. I say sometimes my older clients, you can look at if you have older adults in your home or grandparents, their skin even looks a little bit more frail. There's a reduction in their kidney mass function, so their kidneys are not functioning normally. This is just normally, not even if they're in dialysis or anything like that. So then their kidney function changes through life as they get older. The liver mass and blood flow is decreased, okay? And then postural hypotension, that's when you're lying back, you're lying down in bed, or even sitting to standing, they may become more dizzier than like a 19-year-old. So then you're careful when you're taking care of them and providing, like, let's say, blood pressure medications, that sort of thing. The volume depletion and electrolyte imbalance with diuretics. So it doesn't take much for older people to set them off either way. And again, just like I mentioned, I hope I've mentioned previously, like we're their last checks before we give them their medication. So just to be wary of that. If you're checking someone's blood pressure and it's low and you're ordered to give something, you need to question that and call someone into the room and what have you, because you're going to drop their blood pressure lower. So just realizing that as you get older, and we're talking, I mean, I don't know if your chapter does age. I'm thinking like retire 65 plus is what you need to be just wary of. things that you can handle when you're younger, and when you're getting older, your body is just, it gets older. Your organs are 65, 70, 80, 90 years old. And then just going into the pharmacokinetics and specifically like absorption, distribution, metabolism, and excretion for your older adults. So for these guys, they're how their body, so then how their body responds to changes when they're taking medication is altered because the number of receptor sites is not, how can I say, it's not as responsive when they were younger. So things are slower maybe to respond than when you, as a adolescent. Okay, you have different receptors in your body that, let's say a medication is designed for a receptor in your brain or receptor different parts of your body. So how your body, when you take medication, how the receptors open up and take that medication is not as sensitive because they're aged. Um, their reflexes are a little bit slower to begin with. And then you're looking at, again, different receptors. So every organ has different cells that do different things. So medications, they need your receptor sites to open up so that it can be absorbed in. And so, like your neurons in your brain and different receptor sites in your brain, specifically, there's reduced blood flow, there's reduced receptor sites. It probably would be just a good idea to just remember for older adults, they're slower to respond. And so they're easily hypotensive. They're sensitive to different things and medications, especially from a GI standpoint. So then you always want, I mean, you're not going to walk around like on pins and needles, but you notice that like if you ever give someone a geriatric person like Tylenol, it's almost like a pediatric dose, if you ever work in a nursing home. And then as well, when you're going to monitor your adults, especially closely if you're giving them new medication for the first time. It's not, and I know this all sounds scary, but I think probably because when people think of older adults, they're like, oh, they can handle it, but they're frail. They're not, I mean, their bodies have withstood a lot over the years. And so drug interactions are common because they're usually on so many different things if they're in the hospital or especially in the nursing home sort of thing. And so when they talk about, like, say, therapeutic failures, which means when they're trying to achieve like a blood level or a certain medication, it's a little bit more challenging just because of the age of their organs. It takes longer for receptor sites to respond and different things to respond. Um, and so a UTI can turn into a bad kidney infection quick if it's not taken care of early and handled with appropriately and not just think, oh, they always have problems with their urine sort of thing. So just be aware too that again, the very young and the very old are more fragile as far as medication perspective. Just keep that in mind. Nothing to be afraid of. Um, when I have an older client, take I take extra time with everyone, but you have to just review stuff and call pharmacists and like, I want to add this, but their kidney function is this. What do you think? So just be careful. There's a reason why they specifically want you to focus on knowing and being careful with medication administration for the younger and the older adults, and just be aware of that. Um, Adverse drug events can happen in any setting. They're not specific to the young or the very old, but it probably may be a little bit more underreported. Um, I would think maybe if they're taking care of themselves at home, they may not understand why. They may not be able to afford a medication, so they're not taking it as prescribed. Um, they may not, again, understand properly that you're supposed to take it this way and with food. And so there's a lot of education. And then when you think you've educated, you always want to re-educate again. Now, what are we taking this pill for? Because their memory is not what it used to be. So you're going to educate, and just be extremely patient. With the pediatric folks, always someone's going to be caring for them. They have a guardian, they have a mom, they have a dad, they have someone, foster care, some adult you can talk to. They're probably not going to be a geriatric patient. It could be. But with the geriatric folks, there's a lot of people that live alone. And just keep that in mind. So if they have glasses, make sure they're wearing them when you're talking to them about their medication. Their hearing aids, make sure it's functioning in place. All of these things may not seem nursey, but if you're noticing that the patient has the glasses on, maybe they don't want to wear them. They need cataract surgery. The nursing realm, it covers so much than just giving a pill, because at the end of the day, you want to make sure that they are understanding what they're giving, what why you're giving this, how it's taken, and you just need a little bit more patience and time and respect, because they've lived so much longer than you have. Limit distractions, which again, you want to limit your distractions whenever you're talking to a patient or educating them, but especially with the older adults. Okay. Um, you want to face them, you want to look at them, you want to talk to them directly in their eyeballs. And I do a lot of feedback now. Tell me why we're taking this Coumadin. What are we doing this for? So just keep that in mind. Use large print. All right. You don't want to be disrespectful and look like you're using a crayon or something like that. But large print, teaching aids, I keep things extremely simple and respectful. I always review, you're always going to do a review. And this is, again, if you get into a really good habit of, an older patient is coming in, they have a boatload of medications, you're going to need to take your time and sit down with them and go over that before and after their visit if you're adding new medication. So nurses do a lot of what may seem like hand holding. Maybe it is, but we're the patient's guardian angels and their advocates. So we got to make sure that they understand what what you're giving, why you're giving. It's ordered, but you're the one that's going to give it. You need to make sure they understand what you're giving them. Um, and then as far as teaching is concerned, clear, simple messages. Always ask, because they may go to multiple doctors. They may go to a cardiologist. They may go to a pulmonologist. They may go to an orthopedic doctor. They may go to a neurologist for this, that, or the other. And so the systems aren't, they may go to a Dr. Banner, a doctor at TMC, and doctor this. So it's really important that you do a thorough review of their medication. And I will add over-the-counter medication, everything, anything you're taking from medicine that you're putting into your mouth, I need to know what it is. And then they say consider use of memory aids. There's different things that you can help people with. Write it on their calendar. More older people are becoming slightly tech savvy. Let's keep that in mind if they have a hard time remembering things as well. And then as far as like clinical judgment, you'll hear clinical judgment, critical thinking probably throughout your time with GCU. That's something that I don't want to say it takes time, and a lot of times like life lessons will teach you some things as well. You can't teach somebody critical thinking, but you can slowly, especially as you're doing your clinicals, just look at things, look at surroundings, look at how folks interact with their family when they are there and when they're not there. Um, so when it says like recognizing cues, all that means is that like if you had a your kid, like you know your kids, right? If you have kids, I don't know if you have kids. Let's say you have a dog or whatever. If they're holding their stomach, you know that, and they're not saying anything to you and they're grimacing, that's recognizing cues. Recognizing cues is like being aware of something without someone necessarily verbally telling you, you know. Um, that's that's the best way to explain that. And then you're taking those cues and you're using it to start to analyze, okay, she was over to a sleepover last night. They had Mexican, love Mexican food, nothing against Mexican. I wonder if anybody else got sick. When did she poop last? Stuff like that. That's what you're starting to, but for older adults, are they by themselves? Are they living alone? Do they have some type of social support? Um, if the daughter's in the house, is she supposed to be taking care of mom? Is there any elder abuse? Not, just kind of being aware. And then again, you're prioritizing safety, your ABCs, if anybody's having shortness of breath, that sort of thing. You're prioritizing if something is of dire importance right this moment, or how far down on the list is still important. And that takes time. Well, if someone is living by themselves alone, and let's say they are on oxygen and CPAPs, they're going to need some support. That's what it's done. And then you coordinate, talk to people, talk to the social worker. You can't do everything by yourself. There's no way. But you are the eyes and ears, and especially when you have that BSN behind your name, people are going to look to you. So you went in to see Mr. Smith, because the doctors are not there all the time. You're there all the time. Well, 12 hours, 8, 10, whatever you do. So you are the person that can be the most reliable medical information for people that are coming in asking you. And then generating solutions. And then I'm not going to get into this too deeply. There's a lot of things you'll find that you can do as a nurse that does not require an order. I'll just say that. As far as generating solutions, it may be calling the doctor for and letting them know and getting orders and you've solved it sort of stuff. But there has to be, if you're recognizing cues that need to be addressed and prioritized, there has to be some type of solution. You have to spearhead that. And then you take action. All right. You observe for any reactions. If let's say you're giving somebody something for a stool softener or something for constipation. Um, Changes in their behavior. I've had patients when I used to work nursing home a long time ago to where their behavior would be more erratic. And let's just say they're not as verbal or what have you. Their moaning is different. They're telling me they're in pain. Like that just takes time. Unusual behavior because Miss Smith doesn't really behave that way. So what's going on? And then trying to, again, there may be times to where you may have to request non-child, you have to respectfully request child-proof caps if they're taking too much of their tramadol or things of that nature or what have you. But again, your whole point is to keep folks safe. And as they age, they may require more assistance, more teaching, more education, and that's perfectly okay. For this particular section, I'm going to wake y'all up a little bit, and we're going to do a little critical thinking. So I want you guys to type your answer into the chat box. Number one, when administering medications to the older adult population, which of the following physiologic changes of aging does the nurse realize can affect drug activity? I'm gonna let y'all read it again. Stop talking and type your answer. Everybody's good? I want to hear from Kaylee, Kylie, correct me,
Yeah,
Albertson, one of my
Kaylee.
favorite places. Kaylee,
Kay Yes, ma'am.
what's your answer?
I put B just because um I read the question as like drug activity, so if the drug is going through the liver and it's being metabolized there, then maybe that would be the answer.
I like your thought press. Peace. What you got? What's your answer?
Mm, I'm still reading. I'm still reading.
You still praying over it? Mm.
Yes.
All right, then let me go to Hannah.
I agree with B because we had just talked about how they have decreased liver mass and blood flow to the liver, and that can cause different drug effects.
So the correct answer for this particular question is D. B is, I know it's confusing. Actually, this came straight from your chapter. Okay. So decrease liver blood flow. They talked about receptors. Increase GI blood flow is the correct answer. Just go back and review that particular section in your chapter about drug activity. Well, we can talk about it a little bit later, but let's just keep going for the moment. But it's actually D. Did anybody have D? Don't say D if you didn't say D. No. Everybody had B? Hmm. Number two. Which of the following does not cause adverse reactions and drug interactions in older adults? Does not. Peace. Are you ready? You can guess.
Oh, okay, I would say C. Yeah, I'm guessing, but I think it's C.
Miss Patel?
I said C for the fact that we had discussed earlier that a lot of elderly patients do go to different providers. Like you said, they go to Banner, TMC, et cetera, et cetera. So there's different providers giving different medications. So I went with C because I thought it was the best fit.
Correct. Are you guys seeing this thing on my screen? No. I just got this little sign. You're not seeing a little white square? No?
We can see like the next slide though.
It says running out of time. Upgraded Zoom Pro. Okay, better behave. Um, which of the following terms describes older adults taking many medications together? It's a term. That should be super easy. Everybody got that one correct? If not, talk to me later. Which is a physiologic change seen in the older adult that has an effect on drug administration? Everyone typed their answer? Okay. Getting a lot of D's. Kaylee, who can see your messages recording on? It was just go ahead and ask me. What's your question?
I was just asking, well, more telling you that like the next slide, like we can all see.
Oh,
So
you can all see?
yeah, so it's just kind of hard for me to like actually guess when I can see the answer right there.
Oh, really?
I didn't notice it for the first one.
Can you see
That's
it
probably
now?
why I got it wrong. But this one
Oh
I was
man,
like,
I gotta
oh,
fix
the answer's
that.
right there. So I was like, oh, I don't know if
Oh,
it's in,
I
like
gotta fix
not in
that. I gotta
presentation
fix my
mode.
screen.
I'm sorry to like
You were trying
ruin
to
it,
tell me
but
on the
I'm
download. Yeah.
trying, yeah, I'm not trying to like ruin it for everybody else either. That was like feeling
Well,
good.
it's gonna, you know what? It's gonna
But
ruin it because I'm gonna have to fix it for next time.
I just feel like I can't learn it
No, you
if I'm
can't. Don't
like,
look at this.
oh, well,
Oh, you can
duh,
see my
you're supposed
next
to
slide
be
coming up.
right, yeah.
Oh, that is not cool. Hang on.
So sorry to be the buzzkill
No, you're not. You're
of the
good.
group
Can you
here.
see it now?
Yes, ma'am.
I gotta fix my screen thingy. No, it's too late. All right. We have many more
Yeah,
weeks
I
of
it's
this.
fine.
Try
It's
not to
not
look over
I've
there.
been trying to like cover it, but then it's like, okay,
It's
well,
not working. It's okay. It's all right. It's okay. All right, we'll get through this.
I'll just look away.
It's fine. Thank you for telling me though. All right, so I'm trying to, yeah, I gotta fix this thing from next time. All right, we're gonna move through it. So everybody knows the answer is lower cardiac output. All right, well, dang. All right, so you're gonna see. So when assessing older adults' renal function, which laboratory value will the nurse monitor? We're gonna try not to, does it come up any, just try not to look over to Kaylee. Kylie, is it Kylie? Kaylee, don't look, just don't look.
Yeah, I'm just zooming in my screen, so
I'll fix it for next time. So did you guys see it last week too?
yeah, I tried to message you about it last week as well, but
You may
I
have, you probably did. Anyway, all right, well, let's get through it. So, yeah, this is week 3. We got 10,000 more weeks left. So, this one should have been an easier one because, first of all, renal. So you got to pick through your words. Let me do a little renal. The only thing that says here about renal. So again, with most things, you should be able to look. Okay, electrolytes. You should be able to exclude to CBC, complete blood cell count. If you don't know the difference between liver and if that liver is liver, and so that one on a test would be the only one that's talk about renal. Okay, all right. So I hate to be the one to tell you, you got the cooties. All right, I'm gonna work on the font of this as well. So same with pediatrics, let's switch over here. So your pediatric chapter, factors that influence their absorption. This is straight from your text, is their age, 6-month-old compared to a 7-year-old, their health status, if they're dealing with any conditions, the way that you're giving it, IM over IV or what have you. But again, the biggest thing to keep in mind whenever I was dealing with, when I did a little bit of pediatrics, then I realized I can't do peds. Makes me too sad. Is the fact that their bodies are constantly growing. All right. They're constantly growing. That's why if you have kids or if you ever getting kids medication, there's a different dosage for their age and all of that from what's going on with their bodies during that time. Their livers and kidneys are growing until they reach a certain age. And so therefore, your route as well. So if you're giving oral, the gastric acidity, as far as emptying and motility, all of that is it. I don't want to say fluctuate, But again, you may be taking care of a 2-year-old, and then you may be taking care of that or 1 month old that's breastfeeding and maybe spitting up, and their intestinal flora is not quite mature. So just be aware of that as well. And as far as like you give a lot of IM and sub-Q injections, more and topical, their skin is thinner. Kind of reminds me of the older adults that we were talking about earlier as well. And then influencing factors on how the medication is distributed. Neonates and infants, think about it, 75% water. Okay. So they are they say as we get older with 50, 55% or what have you, but 75% water. Okay. Your neonates and infants have less body fat. All right. That's just how they are designed. They're mostly water. When I have an infant and that's the thing, like, again, infants make me a little bit more nervous than adults because they can talk. Infants can't talk. I'm like, if they are crying and I don't see tears, that makes me a little bit nervous. That's why I do take care of older adults. Neonates and infants have less protein and fewer protein receptor sites. A lot of this stuff, guys, you're just gonna have to memorize. It's like, why does that matter? Well, that needs you to if they're I don't think I've ever given anyone the protein, but as far as like body mass and that thing as well, and muscle mass, they are again, they're water. They don't have a lot of muscle. They don't have a lot of fat. They're just, especially younger, doesn't take much for them to get dehydrated as well. And then metabolism, all of this, again, when you think pediatrics, you're thinking from birth all the way up until they're 17. Sometimes you'll see 18, but usually it's 17. All right. And so the metabolism varies as they get older. When they're freshly born, they're 1, 2, 3 years old, their bodies have to get used to breathing on their own. GI tract has to start working all by itself. And so just like with adults, you have to double check your dosages and just, make sure your med math is really solid. Um, Infants have decreased, this again, straight from the chapter. So just again, it's, you can maybe possibly think, geriatric and peds is